distinguish the three different kinds of vertebrae that we have. All right? So the first thing that we talked about is these vertebrae all have, if you look at the length of this is your vertebrae, they all have some similar structures. You can tell these guys right here, this right here, the body of it right there, right? Certain things they all have. And so the first thing we're going to mention they all have, let's see, they all have this part back here, which this is known as your spine, right? So this is called the spinous process on the vertebrae. Okay? Spinous process. Then if there's these angles that we could talk about in the body, that are in sections that we can talk about. You have the sagittal section, right? That goes through like this. And there's another one that went through like this. There's another name for some of these. It's called transverse section, right? Or you can go through your body like that. Well, this, on all of these, have this T. It looks like a T, right? The letter T. T. Right there, maybe. This part is the transverse process of the vertebrae. So all of these have a spinous process and a transverse process. So far, so good. Then they all have this part right here, the main part, which is like your disc that you know about, your vertebrae. This is called the body of the vertebrae. So if you look at this big guy right here, you have the spinous process right here, the transverse processes right there, and this big part right here, that's called the body of this vertebrae. Okay? So they all have the spinous process, transverse process, and body. Okay, now, all of these are actually called vertebrae, right? These are called vertebrae. This is a vertebrae, that's a vertebrae, everything's a vertebrae. And we have a hole in the vertebrae, but we don't use the word hole. What do we use?
Foramen.
So what do you think this is called? Vertebral foramen. Exactly. The vertebral foramen goes all up and down the spinal cord, and your spinal cord goes into that vertebral foramen, all up and down. So they all have a vertebral foramen. Now, the other thing to mention, in all of these vertebrae, except for the very first one and the very last one, technically, they all have one sitting on top of it and one sitting below it. Right? You see that? And if we were to point to another structure in between each of the vertebrae, which is right here, right there, that would hurt. Right? That's called the intervertebral foramen because it's between the vertebrae. And you can see it on this one right here too, very close. You can see the intervertebral foramen. The vertebral foramen goes this way, the intervertebral goes that way. Okay? Okay. So they all have what's this called? Spinous process. What's this called?
Transverse
process.
process.
What's this called?
Body.
Body. What's this called?
Vertebral foramen.
What's one there called? Intervertebral
Vertebral.
foramen. They all have that. Now, this part, this body right here, is connected to the transverse process by this little area right here. That's called the pedicle. Pedicle. So the body is connected to the transverse process. This little area right here called the pedicle. So they all have a pedicle as well. Then we have the body connected to the transverse process by the pedicle. But then we have the spinous process right here connected to the transverse process by this region right here called the lamina. Okay, so lamina connects the spinous process to the transverse process. The pedicle connects the transverse process to the body. Does that make sense? If I'm not stalling you, we're going to have a test at the end of today, right? We're going to be a little practical. Okay, so they all have a body, spinous process, transverse process, vertebral foramen, intervertebral foramen, pedicle, and lamina. Okay, they all have that. Now they all also have something else. They're all situated in the body a certain way. As you can imagine, if you look at your vertebrae right here, you have three different kinds of vertebrae. You know, there are always one sitting on top and one sitting below, right? But we don't say top and bottom anymore. We say superior and inferior, right? So you remember how I said a little while ago how things are always connecting to each other and create a joint between the two? But when you create two vertebrae next to each other, this particular vertebrae has a superior articulating process right here. So it's a process that articulates with the other vertebrae that would be sitting on top of it. So they all have a superior articulating process, which means, what else do you think they also have?
Inferior.
Inferior articulating process. So lab practical, you have to be very specific, obviously. You have to spell all this right. So you have to say inferior articulating process, superior articulating process, transverse process, spinous process, lamina pedicle body, so on, right? Okay. So they all have, no matter which vertebrae you've got in your hand, all of them have those structures. Then we look at the body and we say, okay, well, now there's something different about these, and these, aren't there? We actually have, the ones up here are called the cervical vertebrae. The ones in here are called the thoracic vertebrae. The ones here are called lumbar vertebrae. Now you have to know how many of each you've got. And there's ways to learn it, however you want to learn it, but I always say you eat breakfast at 7. Eat lunch at noon and dinner at 5. Maybe if you're normal people, which anybody here normal? Probably not, but you eat breakfast at 7, lunch at noon, dinner at 5. So how many cervical do you think we have?
7.
How many thoracic do you think we have?
12.
How many lumbar do you think we have?
5.
Okay, that's the numbers. Then you look at the skeleton and you say, okay, now that we know that they all have the same structural parts, cervical, lumbar, and thoracic, what we have to then be able to do is identify which one this is, cervical, thoracic, or lumbar. Now there's a couple ways of doing it. Which one do you think this is?
Lumbar.
Yeah, lumbar. A lot of weight is sitting on that one. Then we look at this one and we go, okay, what's the name of this thing called? Spinous process. What's this called?
Body.
Body. What's this called?
Vertebral foramen.
Vertebral foramen. What's this little connection right there called? Pedicle. I'll talk about that part. And then what's this part right here called?
Lamina.
Lamina. What's this structure right here referred to as? Superior articulating process. And one under here.
Inferior.
Articulating process. But what's this called? Transverse process. Now look at this transverse process. Do you see a hole in the transverse process? So what do you think we call those? There you go. Yep, that's it. Transverse foramen. Yeah, makes sense sometimes. Not always, but sometimes. Transverse foramen are only found on the cervical vertebrae. Because guess what's coming down in here? The brain, all those blood vessels and nerves and all sorts of stuff are going through those foramen of your vertebrae. So they're different. Then we have, how many cervical do we have? 7. How many thoracic do we have? 12. How many lumbar do we have?
5.
Do you see anything different about the thoracic vertebrae that you don't see in the cervical or the lumbar? Anything? Ribs, thank you. And just so you know, men and women both have the same number of ribs. Just make sure we're clear on that. So we had 12 thoracic vertebrae. Now the thoracic vertebrae, I think I gave one of you one. That one. Okay, so this is a vertebrae. Now what's this called?
Body.
Body. What's this called?
Spinous process.
Spinous process. What's this called?
Transverse process.
Do you see a hole in there?
Yeah.
No. So it's not a cervical vertebrae. What's this up here called? The
Inferior.
articulating process. And what's one here called?
Inferior.
Your articulating process. If this was a thoracic, there might be a little spot for something to come connect to it. What do you think that would be? Ribs. Yeah. Makes sense? So if you actually go over here and look at it a little bit later on, you'll see that all these ribs come around and they touch at certain spots only on the thoracic vertebrae. And there are little spots on each of these, and one here and one here. So the ribs are up front, and they'd be coming around like this and kind of hit like that. They're called the demifaucets for the tubercles of the ribs. And you only see that on the thoracic vertebrae. You would not see it in the cervical. You definitely wouldn't see it in the lumbar. So you see the demifaucets, the tubercles of the ribs, on the thoracic vertebrae. Okay? Everybody see that? And then, so you got to look at it a little bit closer. This one obviously says T on it. That kind of helps. It's a cheating. You know, but on the practical, we won't give you, hopefully we won't give you one that has a T on it. So, these are cervical, these are thoracic, these are lumbar, and these guys are called ribs. Right? How many ribs do you think we have?
12.
12 ribs. Yes, men and females have the same number. And so, if you look at the ribs, we would also then have to say there's other things about the ribs we can talk about. There's this structure right here. What's this thing called?
Sternum.
The sternum. Everybody kind of knows their sternum, right? But your sternum has 3 parts to it, of course. Actually more than 3, but we're only kind of learning 3. The manubrium, the body, and the xiphoid process. Okay, so the sternum. Manubrium here, the body is right here, and the xiphoid process is right here. The xiphoid process used to be important when you do CPR. I don't know if it still is. You're supposed to find their xiphoid process, go 3 fingers above, then put, that's the way it used to be. I'm not sure if it's still, I haven't done that in a long time. Then you put your wrist above that, and then you start compression. If you do it too low, you can actually crack that. Yeah. So manubrium, body, xiphoid process. And we have 12 ribs. Let's count them. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. On each side. 12 ribs. But the interesting thing about ribs, we've got to name everything, right? There are a certain number of these that are called true ribs. Some are called false ribs. And then there's some called floating ribs. Now, true ribs, 1, 2, 3, 4, 5, 6, 7 of these go directly to the sternum. So they're called true ribs. They have a connective tissue, hyaline cartilage connection directly to the sternum. All the way up to here. These ribs, these 3 right here, as you can see, these 3 ribs here kind of come together. They form one little complete one that then goes to the sternum. Those are called the false ribs. Then you have these 2 guys right here that aren't connected to any hyaline cartilage whatsoever, and those are the floating ribs. Right? In the old days, models would have to surgically remove these. Why? So we had that little, whatever that book was that was big at the time. They're illegal to do. It's illegal to do that now. It's supposed to be. All right. So, how many cervical?
7.
Thoracic?
12.
How many lumbar?
5.
Okay. Now there's another one right here. You see this little guy right here?
Hyoid.
This is the only disarticulated bone in your body. This one right here is called the hyoid bone. And this is only fascinating because if somebody's ever strangled, that is cracked. It's an indication if somebody comes behind you like that, it's usually cracked if someone gets strangled to death. So it's a disarticulated bone in the body is called the hyoid bone. All right. Now the other thing to mention is many of them won't believe that there are these 2 at the top that are kind of special, aren't they? Remember from your childhood days, the atlas and the axis, right? The atlas and the axis are C1 and C2. And these have, the C1 right here has a superior articulating process right here. And it articulates with, you remember, the occipital condyles on the occipital bone. Right? And so these two are unique, and you'll see them in your, here's C2. Little C2 looks kind of cute. Got this little pointy structure on the end called a dens, or the odontoid process, which is kind of hard to say. This allows for you to turn your head like this and it not fall off. Don't wiggle anywhere, which is good. Right? Okay. So, the next thing, the last thing I'll do today, because I know you're overwhelmed, is this guy right here. This guy right here. What's this thing called?
Clavicle.
Yeah, I know. It's called a clavicle. Now, on the practical, this could be sitting there like this, and you'd have to know what it is. But of course, it's not just knowing it's a clavicle, right? There's other things you got to know about it too. This is a beautiful bone, I think. Look at the shape of it. Look how it's shaped. It's shaped because, say, if a football player got hit in the shoulders, there's a major artery. It's called, the coronary, carotid arteries right in here. If someone hits you in the shoulder, this way, this is going to crack out that way, so you won't die. So it's designed in a way that's meant for its function. But when you put it up here, you have one end of this clavicle that's towards this end, and another one that's on this end. This end is called the medial or sternal end of the clavicle. Here. This over here is called the lateral or the acromial end of the clavicle. I would learn acromial preferably in medial or sternal end. Acromial end, medial or sternal end. So on this one, I could ask you, I won't ask you on this one if it's the left one or the right one. You could do that on this. But you could tell just by looking at it, okay, well, that must be the medial or sternal end, right? That must be the lateral or acromial end. And it's probably going to look like this rather than like that, isn't it? Like this would be upside down. But this one actually turns out to be the left clavicle. But again, all the clavicles have those main parts that I just mentioned before. All right? That's a lot, isn't it?